everyone, this is Neha Singh, a fourth year BMS and a volunteer at Healthy Women Tribe founded by Mr. Veer Modi. Today our live is on menstruation and leukoria, and today our guest is Dr. Anwesha Mukherjee ma'am. She is BMS and fourth generation Vaidya, Panchakarma and Garva Sanskar expert. Uh, Good evening ma'am.
Hello. Yeah, good evening. Yeah.
मैम
Am I
आज का
audible to
हमारा लाइव
everyone?
हाँ
Am I audible?
यस मैम So here Dr. Anwesha Mukherjee ma'am, she is BMS and fourth generation Vaidya and Panchakarma and Garva Sanskar expert. So ma'am, today my first question is what is menstruation?
Yeah. Thank you for the lovely introduction. But I would love to correct one thing, that is, I am not fourth generation, I am seventh
Sorry,
generation.
seventh generation Vaidya.
Yeah, it's okay. Yeah. So now your first question is, what is menstruation? I think this is a very common question among the teenage boys and teenage girls, but let's discuss it here. Menstruation is just a normal vaginal bleeding that occurs as a part of every female menstruation health. Okay, so it occurs every month. Our body, sorry, our body every month prepares. Our body every month prepares for a pregnancy. When the pregnancies don't occur, that time what happens? The uterine lining sheds off, and that comes out as a with the mixed with the blood and mixed with some other tissues, and that is the menstruation. That is the menstrual blood. Yeah.
Okay ma'am. And type of menstruation? How?
Yeah, type of menstruation. It's a very uncommon question, and it's a very important question. There are many type of menstruation blood, and on what basis this menstruation blood is best? This is based on the on the type, on the based on the color. The type is based on the color. There are five types: uh, bright red, okay, then medium red, then light red, light pink. Actually, it's not light red; it's light pink. And then there is orange, black, and dark brown. Okay. I will give a very few introduction of each of the blood. I will try, because it's a very a bit of elaborated will be, but I will try to give a short introduction of each of the types. So first comes with the dark brown period blood. Okay, it is absolutely normal to have a dark brown blood. It is normal when it occurs when at the beginning of our period or at the end of our period, and sometimes also in between the period. Why it happens? Because if the blood stays inside the uterus for a long timing, it gets oxidized and it turns into black, the dark brown or black color. Yeah. So it is
Yes.
absolutely normal. You don't have to worry about the color of the blood being dark brown. Okay. Then comes the bright red. It signifies that the shading of the new uterine lining, and it is also absolutely normal. Also, it's normal, and it is also an indicator of having a very good menstrual health. Hmm. Okay. Then comes the medium red. It is also absolutely normal, and it is seen on some of the girls. It's very uncommon, but it is seen in some of the girls who are experiencing 5 to 7 days of menstruation. Who are having a the total span is 5 to 7 days. Okay. So in that time, what happens? The medium red color blood is seen. Okay, this comes the light pink blood. It's not at all a normal color. Okay, it indicates about a iron deficiency anemia. When, how can we understand that we are having a iron deficiency anemia? If and if only you are getting this light pink color or the watery color menstruation, the period blood is this color for last three cycles of your period. Means if your last three period is having a watery or light pink color blood, then absolutely you are having a iron deficiency anemia. So we have to get treated in that process. Yeah. Okay. Next is orange color. It's absolutely not at all a normal blood. Okay. Sometimes normal, I cannot say that it's absolutely abnormal blood, but sometimes it's normal, but most of the times it's not at all normal because most of the times it indicates about a infection. When you are having an infection, like a vaginitis, all these things, so that time you are getting a orange color blood. Hmm? And next is black color blood, which is absolutely not a normal period color of the blood. Okay. If you are having excess pain, if you are having this black color blood, and if you are having a excess clotting also along with this, then it is a sure and sure symptom of endometriosis or a fibroid. Any of the two you are having. Okay. So as soon as possible, if anyone is having black color blood associated with clotting and excess pain, so that time the lady or the female must consult a gynecologist because it's not at all normal. Yeah.
Okay, ma'am. My next question is what is leukorrhea?
Leukoria is nothing, it's just a normal white discharge. Sometimes it's also abnormal. When it is abnormal, when the leukoria, the blood is not white color or not a clear discharge. When the color changes to green and also it changes to yellow, that time it's a sure symptom that you're having something abnormal going on in your uterus or in your vagina. Okay, it's just a white discharge. It's normal, absolutely normal to have leukoria before 11 days or 15 days before your period. It's absolutely normal. Yeah.
Okay, ma'am. And type of leukorrhea?
Okay. Type of leukoria, it can be like of three types. First is physiological, second is inflammatory, third is parasitic. Physiological, I told, that one I told just a few minutes before, that if you are having your white discharge just before your period, 11 days or before your 15 days of your period, it's absolutely normal to have that. Okay. Sometimes also leukorrhea happens because of some hormonal disbalance. For that also it happens. Like in PCOD also, it happens during the PCOD because there is a lots of hormonal disbalance. So that times
Imbalance.
also white discharge happens. Also white discharge is very common in during the pregnancy times. That is also physiological. Yeah. Inflammatory, like in the pelvic inflammatory disease, vaginitis, all these things, uh, these all are inflammatory disease. This, in these conditions, leukorrhea happens. Okay. Parasitic is like the bacterial infection. Okay. How can we know that we are having bacterial infection? If you are having leukorrhea and this leukorrhea is not normal, this is a bacterial infection leukorrhea. How can we know this? If you are having itching sensation, where too much of itching, along with the white discharge, and also sometimes there is of UTI also, then it is absolutely a infective leukorrhea. Hmm? And that time the one have to go for consultation with the doctor because leukorrhea if gets untreated, it can lead to infertility.
How to maintain hygiene, ma'am?
Hygiene is very simple way, but nowadays it's becoming very complex. I have no issues about the tampons with the menstrual cup. I have no experiences about all those things, but all the sanitary napkins that must be changed at least within 6 hours. It must be changed, and even before that, it must be changed if you are having a very heavy bleeding. At least within 2 to 3 hours, that must be changed. If you are having a very heavy bleeding, it must be changed. And if it comes in the like how to wash your vagina, keep a maintain the vaginal health, how to maintain it. Just wash your hygiene, means maintain the vaginal hygiene just by cleaning it with simple water. Simple water, because your vagina cleans itself. You don't have to clean it with anything. The market nowadays, so many things are available in market. You
Yes,
can
ma'am.
clean it simple with water. Some in Ayurveda, what is mentioned that can be used for cleaning the vagina, that is a triphala juice. Triphala can be used, triphala water can be used in case if you're having leukoria, like the bacterial infection of the itching sensation, if you're having, or any infection if you're having, then you can go for a triphala juice, triphala water in washing your vagina with that. In this way, you can the easily it can be maintained. The hygiene can be maintained.
Ma'am, my next question is it okay to have a painful period?
Absolutely not. Absolutely not. Because recently I will not. Okay, let's mention the YouTuber. The something Dr. Siddharth something there is. So he was telling something about the a tablet. I'm not so sound in allopathy, but he was telling a allopathy medicine that pop the medicine, your pain will go away. No need to be in pain. Okay, it's not at all normal to have a pain during the period. You can have a pain, but if the pain is coming in between your work, if you're not able to maintain your work, you're
Yes.
just lying down the whole day, you're lacking of energy, not able to eat, then absolutely the period pain is not normal. And don't go for popping pills. It's not at all good. Don't believe all those YouTubers. They're all going for just publicity, having their means going behind the views actually.
Ma'am, my next question is popping pills the only solution for PCOD and missed period?
No, absolutely not. Popping pills is not a solution for PCOD, and it can not do anything in PCOD actually. Cannot do anything. And in missed period, absolutely not. It can be taken if in emergency condition, if you have, but in that condition also I will tell that I don't prescribe my patient who are, I get a lot of patients who is coming to me with missed period. Like recently I got a patient who did not have period for last 3 months. So I did not prescribe her all those pills to get the period, right? It's not at all okay, because the bleeding they are getting is not the permanent solution. It cannot be the permanent solution. That every month I will pop a pill and every month for that pill will be making me have my period. That cannot be the solution. You have to have a permanent solution. And for that permanent solution, Ayurveda is there.
Ma'am, and is it okay to miss period?
No. Sometimes there is a hormonal disbalance, like in PCOD. Sometimes in leukoria also, due to the complications of leukoria also, it happens that the girl misses her period. And nowadays the stress is also playing a great role in missing the period also, missing the period. It's absolutely not normal. If you're missing a period for at least for 2 months, please consult the doctor immediately.
Okay, ma'am. Thank you so
Yeah.
much, ma'am.
So one another thing I want to discuss here. like recently, even that YouTuber only, Dr. Siddharth, I saw in his thing something. I don't follow it, but I see in my Insta because everyone starts resharing all his videos. So I saw there like he told that it's absolutely okay to have sex during period. It's not at all okay to have sex during period. It's not at all, and it's very unhygienic. Very unhygienic, both for them, for both of the partner, for the girl and for the boy. It's not normal, and it can be very complication can happen if you're having sex during a period. Because during a period in Ayurveda, if you follow the Ayurveda principles, in period we are having a bath. Our bath is high that time. Hmm?
Yes, aggravated,
So if you're having,
increased.
yeah, absolutely. If you're having sex during the period, it will increase more, and you can have more complications. And if your bath is increased more, we can have more clots, we can have more pain during our period. It cannot do any nice to that, any nice to that. That's the thing.
Thank you so much, ma'am.
Yeah. Thank you.